Hello parents, today I have brought a very important video for you, especially for the mothers of the newborn baby. We are going to talk about various tips and tricks about breastfeeding. As a newborn mom, sometimes we get confused when to breastfeed, how long to breastfeed, and so many other worries and doubts are there. So in today's video, we will try to solve many of your doubts or confusions. So let us start. Number 1. When should we start breastfeeding? Actually, as a medical expert, I will like to advise that when you are going to become a mother, in fact, in the last trimester itself, you should prepare that you are going to breastfeed your baby for first at least 4 to 6 months. And it should be started as early as possible, preferably within first half an hour of birth. Whether it is a normal delivery or it is a cesarean delivery, we still prefer the baby to breastfeed within first half an hour to maximum of 2 hours. Because that is the time when the baby has come to this world. He is very active. All the senses are working to their maximum. And that is the time when actually bonding starts between the mother and the baby. So we should utilize this time for establishing our breastfeeding. So it should start as early as possible. As soon as the baby takes birth, there is something called breast crawl. When we keep the baby on the tummy of the mother, it just starts crawling towards the breast, towards the nutrition by tracking its smell. So we should start breastfeeding as early as possible. Number 2, for how long we should breastfeed? We should breastfeed as long as possible, but there are some particular terms called exclusive breastfeeding. Exclusive breastfeeding means we have to give only breastfeeds, nothing other than that, not even water. Only medications are allowed, especially when it has been prescribed by the doctor. But other than that, the baby should not be given anything other than the breastfeed. And that exclusive breastfeeding has to be given for at least 4 months, maximum up to 6 months, because that is the usual time when the breastfeed cannot fulfill the requirements of the baby. And we need to start some outside feeds. But still, breastfeeding has to be continued. And for how long it should continue? As per WHO, UNICEF and medical experts, we should continue breastfeeding up to 2 years. So, as the age increases, the amount of frequency of breastfeeding reduces. And in the last part, it actually just gets limited to only night feeding. But still, we should continue breastfeeding up to first 2 years. For how much time we should feed? Actually, baby should be put to breast at least 10 to 15 minutes on each breast. Once he empties one breast, then only we have to switch to the other breast, because we want to take all the milk from one breast. Many of the mothers, they keep on shifting their breasts and they feed for 5 minutes on one and then 5 minutes on the second. That is not a good practice. Baby should be put on one breast for at least 10 to 15 minutes so that the whole milk comes and baby gets it. Because the milk in the initial part is called foremilk, which is rich in carbohydrates. But the back part of the milk is rich in fats. That helps the baby to gain weight. So we want the baby to get both types of milk, and that is why we recommend that baby should be breastfed for at least 10 to 15 minutes on each breast. And then after that, if we feel baby is hungry, we can shift the breast. Otherwise, on the next feed, we can use the other breast to feed. In what position we should breastfeed? We should position the baby in such a way that baby rests on one of the arm with the head slightly raised above, and the whole body should be supported by that arm. Then with the other hand, we should hold the breast and touch the baby's cheek with the nipple so that baby automatically gets directed towards the breast and starts feeding. While feeding, baby's lips and mouth should cover the nipple as well as the brown part around the nipple, because that is the place where if the baby presses, the milk comes, because the ducts are positioned in such a way. If the baby keeps on sucking only on nipples, baby will not get milk, baby will get frustrated, and mother will also get frustrated, and that is the commonest reason for sore nipples. When should we start outside feeds? As I have already told that all the babies should be exclusively breastfed for first 4 to 6 months. So that means first 4 to 6 months, baby should not be given anything other than the breastfeed, not even water. Only some of the medications are allowed, but otherwise baby has to take only breastfeed. After 4 to 6 months, once we think that baby is asking for other feeds, or our milk is not sufficient, or the baby is not gaining weight properly, that is the probable good time when we should introduce the outside feeds. So that's all for today. I hope that you will like these tips and tricks and they will be definitely useful to you. See you in the next video. Thank you and bye-bye.